Hi, I'm Dr. Steve Newman, Executive Chairman and Chief Medical Officer of CenterForce Health. Today, I'd like to discuss with you the clinical and business intelligence solutions we have, all based on a foundation of the comprehensive determinants of health. So you may have heard that the zip code specific social determinants of health are all you need to understand your patient at a much deeper level. The reality is it's not true. Zip codes are not enough. They don't deliver the sort of insights you need to holistically manage your patients. Conversely, CenterForce Health's proprietary comprehensive determinants of health deliver you the insights you need for a 360-degree view of the patient. This holistic approach to management cannot be provided by social determinants of health. You must have the additional insights, the socio-behavioral insights, the attitudinal insights, the relationship with the healthcare delivery system insights that we uniquely provide for you if you are going to provide the highest quality care and maximize your impact on improving clinical outcomes. So on one hand, the social determinants of health are very interesting. They provide background information that you may be able to use in the care of your patients. But let's be clear. If you know your patient lives in an unhealthy zip code, you're not able to move them to a healthy zip code. If they have a higher education risk, you're not able to confer on them a baccalaureate degree. And if they have a household income under the federal poverty level, you can't double that income. These are not actionable insights. On the other hand, the comprehensive determinants of health provided uniquely by CenterForce Health provide you actionable insights. These 107 proprietary risk scores from CenterForce Health have never been available before. They address those questions to which providers for years have thought the answers were unknowable. What is the risk of someone not completing a course of medication? What is the alcohol risk that a patient has? What is the smoking risk? What is the risk of inadequate exercise? All of this can be determined in advance of your identifying an individual at risk. It changes the conversations you have with patients and customizes it to the issues of risk that can damage their health moving forward. So we at CenterForce Health provide to you the risk scores, 107 of them, that are divided into several categories, specifically attitudinal risk, social interaction risk, socio-behavioral risk, socioeconomic risk, and what we call pre-medical condition risk, the likelihood, the probability or propensity of your patient to develop a serious disease such as stroke, cardiac disease, or even gastrointestinal disease. Our comprehensive determinants of health and the risk scores that are created from them are based on nationally syndicated self-reported data sets. They are completely complementary to electronic health record data, to claims data, and to publicly available data. For the first time, you have all the data you need in order to holistically manage your patients. Well, I share your discomfort with the overwhelming amount of data that is presented to you as a leader of a healthcare system or a health plan today. The reality is we have to find a way to turn that data into information and ultimately into actionable insights. Uniquely, CenterForce Health, with our proprietary derivative data set that is converted into risk scores, does this for you. It presents actionable insights through analysis and can separate the signal from the noise, allowing you to know which are the factors you need to impact to improve clinical outcomes and drive down the cost of care. For many decades, we as providers and payers have focused on the 60% of factors that influence clinical outcomes and the cost of care that include genetics, access to care, and those sorts of elements. But what we know is 40%, specifically the socio-behavioral aspects of patient life, have been largely ignored. That socio-behavioral segment is the largest single influence on healthcare outcomes and the cost of care. Through CentraForce Health's unique comprehensive determinants of health, risk scores, and solutions, you are now able, for the first time, to influence that critical 40% that really makes a difference in keeping patients healthy, out of the hospital, and driving down your cost of care. So I know a number of vendors can provide for you the social determinants of health, and these are important background information, but they rarely provide actionable insights. In the CentraForce Health comprehensive determinants of health, we include not only those social determinants of health, but so much more that provides you actionable insight related to the behaviors and attitudes and pre-medical condition risks that no other organization can provide you. Thanks for watching our video today. I hope you found it interesting and intriguing. If you'd like to continue the discussion with us, please click the link below or contact us through our website. We'd love to continue that discussion with you because there's so much more to tell.